we will start with the technical clauses. So yesterday we covered all the management clauses. So can we once repeat all the management clauses quickly? 4.1 organization and management responsibilities. 4.2 quality management system. Be little louder. 4.3 document control. 4.4 service agreement. 4.5
examination by referral laboratories.
4.6
External
services
supplies.
and supply. 7
Advisory
advisory services. 8
resolution of complaints.
4.9 10
Corrective action.
11
Preventive action.
12
Continual improvement.
13
Control of records.
14 evaluation and audit. 15 management. So now technical clauses have 10 subclauses from 5.1 to 5.10. So we'll cover one after the other. So the first clause, clause 5.1 is personnel. As you all know, personnel is something very important for the laboratory. What should be their qualification, what should be their experience, all those things are determined by this clause. Lab shall have a documented procedure for personnel management. Now this documented procedure you need to underline. This was not asked in 2007. 2012, this is additional point that they have asked for a procedure to be written, how you will handle your personnel. And maintain records for all personnel to indicate compliance with the requirement. 5.1.2 Personal qualification. Lab management shall document personal qualification for each position. The qualifications shall reflect the appropriate education, training, experience and demonstrated skill needed and be appropriate to the task performed. So if you go by these 4 things, they have different meaning. Education, whatever is the degree of the person qualified for so and so. Training, any specific training he has taken in addition to his qualification. Experience, number of years spent on a particular area. Demonstrated skill. So skills, usually we take it as overall skills, you know. A person may be technical person, but he has administrative skills also. So he is a good administrator also. So you would like, okay, this person has this kind of a skill. Somebody can have a very good communication skill. Somebody can have a very good leadership skill, team handling skill. So you have to identify those skills also when you are looking for a person for a particular position. There may be some people who are very good background workers. They are technicians, put them on the machine, they are very good at it, silent, not communicating to anybody throughout the day. They do their work, but their work would be perfect. There are some people who cannot sit at one place, but they are very good at communication, solving problems, looking at other people's issues and helping them. And some have nuisance value also. So you have to see who fits where the best. Personnel making judgments with reference to examination shall have the applicable theoretical and practical background and experience. Naturally, who has to interpret or who has to give the result as right or wrong has to have that knowledge. Now coming to personal qualifications. Professional judgment can be expressed as opinion, interpretation, prediction, simulation, models, values, should be in accordance with the national, regional, local regulations and professional guidelines. So there are various methods of interpreting the results, but the person has to be professionally qualified in that field. So a microbiologist only can interpret a culture report. Histopathology report can be interpreted only who is qualified as MD pathology, right? So you have to take care of that part in the lab. the human resource because we want the maximum productivity out of the people which we have. Now, 5.1.4 personal introduction to the organizational environment. So whenever anybody joins an organization, so what happens? What is the first thing which is done? Introduce. What is that known as? Induction training. Okay. So there is a word, this is a corporate word, they say induction training has to be given to a new entrant who is entering the organization. Lab shall have a program to introduce new staff to the organization, the department or area in which the person will work. So induction training is usually given by whom? Usually by HR. So this is general. It is about what? The terms and conditions of employment, staff facilities, health and safety requirements, including fire and emergency and occupational health hazards. So this is induction, just introducing the person to the organization. Now there are many methods, to conduct this. One thing is, okay, the person has entered, so somebody has taken him around, introduced to everybody, he's your boss, he's this department, this department. What we used to do, I will just tell you, what we used to do was that we had one day in the month where we used to keep a staff meeting. So all the staff was supposed to come on that day for half an hour to be together, and we used to do multiple things in that 1 hour, half an hour or 1 hour, whatever time. So one thing was introducing the new staff. So anybody who's joined during that month was introduced to everyone in that meeting. Anybody who has to leave, so we used to have a farewell also at the same time, that these people are leaving on this month. Then we used to have a best employee incentive, that this month this particular employee worked the best. We used to have a team who would judge and give that certificate to that best employee, so that he feels important in front of everybody, and that keeps rotating in different departments. Then we used to celebrate birthdays. On that month, in that month, how many people, 6, 7, whatever number of people had birthdays. So we would cut a cake and celebrate birthdays for those people. Then we'll talk about any problems happened during the past month, any major issue anybody faced, or anything happened in the organization which needs action. So anybody can just come forward and tell this was, the problem, so we must be careful about this. It may be related to any admin problem, maybe related to any customer problem, any technical problem. Then we would discuss about the coming month, supposing dengue is coming, or NABL survey is going to happen, or any important activity expected in the next month. So that is also discussed, followed by a cup of tea and some snacks. So initially everybody used to feel, oh, this meeting, and then it had become so lively that everybody would look forward, no, we'll not take leave on that day, because that's the day when everybody is going to meet and we'll have fun. Fun in the sense that those people who have their birthdays, everybody will sing happy birthday, or anybody wants to crack a joke, anybody wants to sing a song. So it became like a very, very nice opportunity to meet others, to say hi, hello, because normally you see what happens most of the times, people enter, they start doing their work, they don't even communicate to anybody. So that became a communication platform, and of course doing the work and meeting everybody and talking about the previous and the next month and their problems, their issues, good points, bad points, everything we could discuss. So anything like that. The purpose is giving an example that something like that, which is very important for the motivation of your personnel, should be there in the organization. It should be that when people get up in the morning, they should love to come to the organization. They should not be, oh, they have to go to work. They should be, oh yes, today we do this. That should be the attitude. The attitude should be work oriented. That my work is left, no, I can't leave. Not looking at the watch that I came at this time and I have to leave at this time. It should be that my work is there have to finish and go. So that kind of a atmosphere in the organization is very, very important. So we were talking about the qualification and now trainings. Lab shall provide trainings for all personnel which include the following areas: quality management system, assigned work process and procedure. So these are the 6 trainings which standard has clearly told that this should be a part of training for everyone. Quality management system, assigned work process, whatever is the duty of that person. Applicable LIS. These days every lab has LIS system, there is no lab without LIS system. Health and safety, including the prevention or containment of the effects or adverse incidents. Ethics, confidentiality of the patient information. So these are also, if you see, common trainings except assigned work process, which may be different for different people. Okay. So when you are making a schedule of your trainings, normally labs make an annual schedule, so you have to keep these 6 trainings in the schedule. Right? Personnel that are undergoing training shall be supervised at all the time. Effectiveness of the training program shall be periodically reviewed. So next is what? Competence assessment. So what do you understand by competence?
taking exam of the students का एग्जाम देना चाहिए so that we हम उनको सिखाए तो हमें पता होना चाहिए कि ये उनको आ भी रहा है सीख भी रहे हैं तो उसके लिए एग्जाम्स कैरी करना
So how capable a person is to do this technical job? Okay, that's competence. Yesterday when we talked about certification and accreditation, so these words are very important there also. Certification is only management, so it is more so about compliance. This is written, not followed, non-compliant, that comes in the management part. Accreditation is more so about the competence because it has a technical component to it. So we are not only judging compliance as well as competence. So competence gets related to the technical job of a person. How competent he is to perform his area of work, his job profile which has been assigned to him. Following the appropriate training, lab shall assess the competence of each person to perform assigned managerial or technical tasks according to the established criteria. Reassessment shall take place at regular intervals. Retraining shall occur whenever necessary. So there will be a training, then you will take a test to assess what have they learned. If you find no, they need retraining, then you will retrain and reassess. So this is a continuous process. Competence of lab staff can be assessed by using any combination of all of the following approaches under the same conditions as the general working environment. So standard has very clearly given these points. Okay, so you can give marks to these points. Every point 5 marks or 10 marks or whatever, and then you can judge the competence of different people in a quantitative form, that this person gets out of this criteria so many marks, so that becomes easy for you to check the competence of a person. So what are these? Direct observation of routine work processes and procedures, including all applicable safety practices. Naturally, if somebody is working, somebody is observing also. Direct observation of equipment maintenance and function check. Everybody is handling one equipment. Monitoring the recording and reporting of the examination results. Review of work records. Whatever records they have generated, you can review and see how he is keeping all the records, how he is maintaining all the records. Assessment of problem solving skills. Now what is this problem solving skill? So as I told you, skill means not only your routine work, but everybody has a different skill set. So some people have very good problem solving skills. Okay, those people become better team leaders because they not only solve their own issues, they will help others also to solve the problems. You must have seen there are certain people who will say anything happen, they leave their work and come. What happened? Tell me. And they will come out with some solution also. Why don't you do like this? Why don't you do like this? Right? So you need to identify and give them marks accordingly. Examination of specially provided samples such as previously examined samples, ILC material or split samples. So this can be a given task that you've given them split sample or you've given them into lab comparison samples to perform and then see how they do. So one thing is in their regular routine and one thing is specially giving them some work and then observing what are they doing. Competence assessment for professional judgment should be designed as a specific and fit for the purpose. Naturally, whatever is the work assigned, you will judge that part only. You can't expect something else from that person. Now comes review of the staff performance. Now comes review of staff performance. In addition to assessment of technical competence, lab shall ensure that review of staff performance consider the needs of the lab and of the individual in order to maintain or improve the quality of the service given to the users and encourage productive working relationship. So how it is different from the competence? We have checked the competence. Now we are saying staff performance. So what does it mean?
Periodically after a time period, taking the performance.
Yeah. So when we say performance, then it includes other features also. Competence, as I told you, is specifically about the technical part or their work related observation, what they are doing as far as their job profile is concerned. When we talk of overall performance, then we are more bothered about the output. Okay, what is the output? And that will also include what else? Their punctuality, their behavior, their relationship with other people, their communication with the seniors, their communication with the customers, their otherwise their responsibility attitude, are they finishing their work on time, are they feeling responsible for whatever work given to them, right? So it has, in addition to competence, certain other factors which should be included. And normally the staff performance is generally checked before appraisal. Whenever there is a raise of salary, there is a appraisal. So staff performance on the whole is checked, where competence becomes one part, but there are other features also which are important for the output, because all these additional factors will help in the overall output of the laboratory. Person may be very good at his own work, but then he is fighting with everybody every other day and disturbing others, or the atmosphere is not congenial when he is present. So that affects the performance of the whole lab, right? So next, 5.1.8 is continuing education and professional development. So you all know in continuing education, what are we expected to do? Attending CMEs, attending various trainings, conferences, organizing certain symposia in your organization. Then very important are pathological clinical meetings, where you can discuss your problems and your issues with the clinicians. What else can you do? Any new tests you have started, you can talk about those so that they are also aware that these are the new tests which the lab is doing. Any issues you are not getting histories for various tests, so you can communicate at that platform. Case studies, interesting case studies, where they also have something to contribute and you also have something to contribute. It's very important to communicate with your referring doctors, because otherwise, you are treating the samples just like samples, not like patients. For us, these samples are what? They are patients. Okay, but if you are not communicating to your physician, they become just like samples. When you are communicating, you know about the patient, what happened, why this is happening, what is the interpretation, what better tests can be done, what additional tests can be done. or if this was the report, then what happened to the patient next. So try to follow those patients. Maybe not every patient is possible because the number is large, but whatever interesting patients, interesting case studies, you must communicate to the physicians. That will improve your knowledge as well as their knowledge, and ultimately the benefit goes to whom? To the patient, which is our purpose. So, personnel shall take part in regular professional development or other professional liaison activities. Now, if you see, what have we covered? What were the clauses under personnel? First was induction. So, the moment anybody comes, induction training is given. Then, certain set of trainings which are regular throughout the year, they have to be given. Then, their competence assessment. Then, staff performance and its review. Then, continuing education and professional development. Now comes the records. Now, interesting thing about this standard is that after the last subclause of every clause is about the records. Once we will talk about machines, the last clause is records. So they have made it very clear now. So very clearly it is written what should be the records in every personal file. Every person, every employee will have a file. That file may be in the HR department, that may be in the laboratory. That depends upon your organization. But it should have what all? Records of the relevant educational and professional qualifications, training and experience, and assessment of competence of all the personnel shall be maintained. These records shall be readily available to relevant personnel and shall include but not be limited to educational and professional qualifications, copy of certification or license when applicable, previous work experience, job descriptions, introduction of new staff to the lab environment, training in the current job tasks, competence assessment, record of continuous education and achievements, review of staff performance, reports of accident and exposure to occupational hazards, immunization status when relevant to assigned duties. So, are you people maintaining? So, all personal files 1, 2, 3, 4, 5 clearly written, these should be there in the file. Records listed above are not required to be stored in the lab but can be maintained in other specified location. That means it can be there in the HR department also, but should be accessible when required. So when assessors come or when audit happens, so you can't say we don't have, they are with HR. So you should be able to get those files from HR when required. So any question about personnel? It's very simple, clear. Now what is important in personnel is once you go through NABL 112, 112 has very clearly tabulated what qualification can authorize what kind of reports. A pathologist can sign what all reports, microbiologist can sign what all reports, a pathologist can sign routine biochemistry and routine microbiology. Of course, clinical pathology, histopathology, hematology, but not special microbiology, not special biochemistry. Same way it applies to other specialty. What a PhD can do, what a MSc can do, how much experience is required for them for authorizing anything. For genetic reports, what should be the qualification. For flow cytometry report, what should be the experience. Okay, so there might be a pathologist who has, in MD pathology they have done histopathology, but for last 10 years they have never practiced histopathology. So can he sign a histo report? Cannot. So along with qualification, the experience of a person also matters a lot. Training also. For example, flow cytometry report. So flow cytometry cannot be reported without having exposure to that particular area. Okay. So now next clause 5.2 accommodation and environmental condition. So this is about what? We have talked about the persons, we will talk about the infrastructure. how should a lab be, what should be the size of the lab, the temperature, the humidity, and all these things. The lab shall have space allotted for the performance of its work that is designed to ensure quality, safety, efficacy. All the three words are important: quality, safety, efficacy. So what does it mean? That we have to, there is nothing quantified as such about the size. For example, in blood bank, it's very clear that this much should, so many square feet should be the area for blood bank, this should be bleeding area, this should be testing lab, this should be, but in the laboratory, there is nothing specific which has been quantitatively specified that the lab size should be this much or that much. It is only, it should have proper quality, safety, efficacy. Lab shall evaluate and determine the sufficiency, adequacy. See, all qualitative terminologies have been used. Sufficiency, adequacy, which is very, very subjective. It happens many a times when assessors go. Now, one assessor feels, no, it's a good size. The person who has come from a small lab will find, okay, the size is okay. Person who has come from a bigger lab will find, oh, such a small lab. No, it should have a larger size. So, there are certain question marks. It's very, very subjective about the size of the lab. Okay. Then, department to department also it makes a difference, right? Because some departments have to have separate areas for safety reasons. Some departments can work together. For microbiology, for example. So, what do you need? You need separate areas. You need separate area for TB culture, for culture, for media preparation. Okay. So, if they are not there, that means the space is insufficient. So, this applies to all parts of the laboratory, including your sample collection area, including your main lab, including your report delivery area, that the space should be sufficient and efficient. For POCT, for this everything applies to POCT also, where you are having POCT machines, there also you have to be careful about the space and the environment, the temperature. Then lab and office facilities. Lab and associated office facilities shall provide an environment suitable for tasks to undertake and ensure the following conditions are met. Access to the area affecting the quality is controlled. So what do you understand by controlled? So means only those people who are permitted to go in should go in. Not everybody can go in. So lab has to be a controlled area. Okay. Now lab, if you see these days, the lab is not only the technical part. There are so many areas. There is an area for accession, where samples have to be received. In larger labs, you have to have large areas for accession. There has to be area for logistic people to come and deliver the sample. They need a place to sit. You need a place for your lunch. You need certain place for doing the office work. Purchase needs a separate department. Store needs a separate area. So not only the machine and the technical work, there are many other areas which are required in the lab. The office area. Lot of office work is also related to the laboratory. So there has to be area for medical information, patient samples, lab resources are safeguarded from unauthorized access. Facility for examination allow for correct performance of examination. These include energy sources, lighting, ventilation, noise, water, waste disposal, environmental conditions. So all these things have to be proper. Communication system we discussed yesterday also. So what are all communication systems?
Messaging, mobile, email also.
intercom, email, mobile messaging. So all kinds of communication system should exist. So it should not be that one person is shouting that I asked you that report. So there should not be any shouting in the laboratory. Safety facilities, safety devices. What are the safety devices commonly used? Fire extinguishers. Then first aid box. Then spill kit. If there is a spill, you have to handle that. How that has to be. There is a needle injury, what emergency has to be, how it has to be handled. Then personal protective equipment, your lab coats, masks. Then if there is a splash, then you have to have immediately how you have to handle. Eye wash should be there. Eye wash with the proper equipment, right? So all these are safety equipment which should be there in the labs. Then if you have walk-in freezers, then emergency alarms, temperature change has happened, nobody comes to know because it is a separate room altogether. So if there is a raise in temperature, immediately alarm should ring. Then comes storage facility. So there was office facility, there was safety equipment, now storage. So what all things you need to store in the lab? Samples, documents, equipment, reagents, consumables, certain records, and your results, whether in the soft copy, hard copy, but you need storage space in the lab. Clinical samples and materials used in the examination processes shall be stored in a manner to prevent cross-contamination. So how do you do that?
Samples should be separate.
Separate refrigeration for the samples and for the reagents. Then disposal. Disposal of dangerous waste material and storage of dangerous material shall have appropriate methods to follow. Then comes 5.2.4 staff facility. Again a new addition. So yesterday we did staff suggestions. It was there, staff suggestions at the time of evaluation of the lab. Now it is staff facility. Adequate access to washrooms, to a supply of drinking water, facilities of storage of personal protective equipment and clothing. When possible, lab should provide space for staff activities such as meetings and quiet study and rest area. So rest area for what? Rest area doesn't mean that there should be 1 hour break for sleeping also. So not like that. It is that there should be a proper space for people to sit and eat, and lunch area. I've seen personally most of the people, eating within the lab only. Lunch break, they are having their food in the lab, which should not be allowed. There should be separate areas for all these things. Then 5.2.5 is patient sample collection facility. Collection area is again very important. So what are the 3 areas which should be there in the sample collection area, which are very important?
First, sample taken, then separation of the samples, registration.
No. As far as infrastructure is concerned, what should be there? How the rooms should be there? Is one room enough? There is one room for sample collection area. Is it good enough?
Female section, male section.
No, not really required. Male-female section is not required.
Waiting area.
Waiting area, yes. So every collection area has to have 3 areas: waiting area, phlebotomy area, and bathroom. Because these are must. Waiting area has to be separate from the phlebotomy area. Whether you put a wall or you put a curtain, but you have to give privacy to the patient while you are doing phlebotomy. And if you are doing FNAC also in that area, then in case it has to be absolutely private, which can be closed. Okay. Then you have to have facility for disabled access. Those people who are on wheelchair, how you will take the samples, that part also you have to take care. Then even interpreter, if there is a language problem, then there should be somebody who can communicate to the patient, especially it happens in rural areas, peripheral areas, so the people are speaking local language and maybe the other person doesn't understand. So that has to be taken care of. Facilities at which patient sample collection procedures are performed, phlebotomy, shall enable the sample collection to be undertaken in a manner does not invalidate the results or adversely affect the quality of examination. So for this purpose, what should be there in the collection area? So that the integrity of the sample is maintained.
Temperature should be maintained.
Temperature of the sample collection area should be, so there should be air conditioning. What happens? You make your labs air conditioned, you control the temperature, note down the temperature, and your OPDs where sample is being taken, they are very warm. Patients are sweating, samples are lying there for 2 to 3 hours. By the time they reach the lab, they are already spoiled. So what is the fun? So your sample collection area where you are keeping the sample has to have proper temperature and preferably a refrigerator. If you think that it takes some time, then better it is to keep a refrigerator. And one more equipment, centrifuge machine. Certain samples require separation, early separation, so you need to have centrifuge machine. Especially if your collection center is little far or it is a franchisee center or somewhere from where the samples come after 4 hours, 5 hours. So you need to have centrifuge and refrigerator. These two things are must. Then some facilities may need equipment appropriate for resuscitation. Local regulation apply. So why do you need resuscitation? What are the common complications which happen while doing phlebotomy? Fainting. So patients sometimes go into vasovagal shock. The moment you prick them, they go into vasovagal shock. So how do you resuscitate? You have to make the patient loosen the clothes, make them lie down, head down and legs up, and then check a pulse, and if it is a hospital, immediately call the doctor. And otherwise also you should have a tie-up with the nearest physician. In case required, you should be able to either transport the patient or call the physician over there so that no major emergency happens in the collection area. Then comes 5.2.6 facility maintenance and environmental conditions. Some people are very prone to vasovagal shock and they know it also. Once it happened, one female calls me up, she says, Doctor, my husband is coming to give the sample, are you there? I said, no, I'm not there, but staff is there, they'll take the sample, no problems, you can send your husband. She said, no, I want to send him only once you are there. I said, why so? Anything in specific? So she said, no, last time we took the sample and he fainted. So I want some senior person, some doctor has to be around while taking the sample. So I said, by chance it happened, it is not necessary that every time it will happen. So, but still, she sent it the next day when I was there. And it actually happened. The moment he was pricked, he just went it. So some people have a history that every time they have a shock. So you have to have, such things are sometimes not foreseen. Especially if you put in a very junior person on the sample collection area and has not been trained properly on these issues. So they get confused. They don't know what to do, how to handle. So training on all these things, training on first aid, training on vasovagal shock, training on how to handle the needle prick injury immediately. All safety measures has to be in the proper training. Every person who is dealing with those areas has to be trained on this. So lab premises shall be maintained in a functional, reliable condition. Work areas shall be clean, well maintained. So that we all know. Everyday cleaning, cleaning of the machines, cleaning of the premises. Okay, that has to be there. There shall be effective separation between lab sections where there are incompatible activities. So generally the infected material is handled separately, as we just talked. Micro department, media preparation, inoculation, TB culture, they all have to be separate areas so that no cross contamination happens. Lab shall provide quiet, uninterrupted work environment where it is needed. So where is it needed? Most of the times, uninterrupted atmosphere. Histocytoreporting. A person who is doing histocytoreporting, if he is sitting in the middle of the lab, everybody is talking, shouting, he cannot concentrate. So there are certain reportings where every time you need a book or you need to think about, or then sequencing, in PCR, genetics. So certain areas where you need to concentrate or you need to refer a book or some reference, there should be a separate area for reporting. So this was about 5.2. So the major thing to understand is no quantitative measures have been defined anywhere for the lab size. It has to be adequate for the kind of work you are doing, how many departments you have, how much workload you have, what kind of machinery you are dealing with, what is your menu of the lab. Accordingly will be the size of the lab. Flow of the sample should be smooth. It should not be that there is one machine, then in between there is a sample collection happening and then there is something else. Sample collection area has to be separate, then comes accession area, then separation of the sample, then it moves to the lab and then different departments of the lab and then it goes for reporting. So that flow has to be smooth. So now we are finished with 5.1 and 5.2.